For my final assignment, I have chosen to talk about my experience. I had this placed in me, which is a catheter that goes to my biliary duct from the result of my gallbladder being taken out in 2015. As a result, I had the gastric bypass in 2004, but they didn't take out my gallbladder, which they were supposed to do. The doctors never explained, was it a result of a gallstone being stuck in it? But moving forward over the years, I had been having problems with my pancreas. They thought I had pancreatitis because I was having pain where the pancreas was. Actually, it was the bile duct that holds this fluid that secretes the acid that burns your food up. The bag being pressing against my liver and my pancreas. So they really didn't know what they was talking about. So last year, my original gastroenterologist scheduled to have a procedure done in December because I was in school. But before then, my pancreas flared up again. It flares up when I eat certain foods. Under the care of the hospital, I'm at Advent Health across from USF. They came in while I was literally drugged up. And they didn't ask me, they told me, we're gonna have your surgery early. I had no decision, no say-so in this or anything. So the next morning, just because I know the IR, radiologist, from a prior procedure, they told me, the original gastroenterologist told me, we'll have a little cup and it'll be for 2 weeks. So I was like, okay, drugged up. I said, okay. So the next morning, the guy that did my other procedure, that did the first batch of this, said, do you know what's going on? I said, they said I'll have a little cup and in 2 weeks this will come out. He said, no, you will have a big bag, which I don't have the bag. And this might take longer than that. Not knowing longer will be 12 months when I found out 4 months later. So October 11th, they placed this in me. I was in here for pneumonia, caught pneumonia. I want to talk about the service here, patients and their care, which I learned in my communications I happened to be taking. It was no patient-centered care. It's like you are an object, you are a subject, you have no say, you have no feelings. They come in the morning, talk to you, and literally like robots. They talk to you like they're reading a book, the doctors. They don't ask you how you doing, how you feel about anything. So me taking that class, I brought up some definitions to them, and they had to ask me, what is your occupation? And it was like, I told them communications. And that let me know that when I finished the story, that let me know something. So I didn't have a gastroenterologist to monitor this. So the IR doctor which is not a real doctor, he just does the procedure. After 4 months in January, when I started your class, after 4 months, it was infected, terrible, I'm in pain. He didn't have a doctor, so he got scared if I called my insurance and made a grievance. He told me to come in. I could take it out, but you'll get jaundice, this and that. I said, okay, I'm in school now. I don't want to mess up in school. Oh my God. Did not tell me that he would have to keep up in this. Come to find out, I just found out. Because I don't have a gastroenterologist, the head doctor of this hospital, gastroenterologist, is making decisions. I have a lawyer now. They're making money off of Medicaid and Medicare. They was planning on upping this thing and not monitoring. I say this because I just had an incident last week when my nurse made me come here because she was like, "It's ridiculous. You got pus coming out the bag and all kinds of stuff. Disinfected." I got here, they said it wasn't infected. But what can you do? You can't argue with them. They never took a visual eye of my incision. They're going by lab work. Okay, they said it wasn't infected. I said it has to be. Okay. They said, well, we're going to schedule you for Tuesday to go have this, they told me it was being taken out. I got there, me and I thought it was the doctor, another IR doctor, but actually it was the anesthesiologist. He was like, we're upgrading this. I said, no, they're taking it out. It's not what you say. We're upgrading it. I felt offended. Me being me, I looked at him. I found myself arguing with a man. I don't argue with men. I don't think men should argue like women, back and forth. So I just did him like this. And I said, I don't want to talk to you anymore. He walked out. But not knowing, they didn't know that I had a gastroenterologist now. And I was so glad that I had a lawyer. I was so glad that the two nurses witnessed the doctor saying that they was going to take it out. So who comes in here after they wheel me back on Tuesday? They had gastroenterologists trying to reiterate what she said. I feel now I found out I have to have a robotic surgery. A robot is gonna actually go in and make a pathway because of the destruction and the scar tissue from my gastric bypass. Originally, they wasn't supposed to do this because I had a gastric bypass. I have scar tissue. This doesn't work with scar tissue. So, I'm upset because the original gastroenterologist got off my case with no reason why. And I haven't had a doctor monitoring this. I feel that's an injustice. I feel like when I figured it out that my friend deals in insurance fraud and stuff like that. This goes on every day. We had an incident last night where I'm jumping subjects, pressing the button. I'm on the floor with a lot of elderly because I'm being observed in their 80s. Some have dementia. We have nurses here that's not in here because they're angels. They're here for the money. I'm pressing the button. Nobody's responding to me. But one thing they didn't know is I know the nurse leaders from past experience. So that's why I'm taking up communications, really, because I want to be an advocate for persons living with a disability. I want to be a voice, because all I could think about, how many patients on this floor was pressing that button for pain meds and other things that they was ignoring, that doesn't have family visiting them. How many patients are getting ignored and abused by young ladies that's just taking nursing because it's just paying their bills. Nurses are supposed to be angels. I could tell a real nurse, because if it was your mother, your sister, your child, or even you, if you experienced it before, you wouldn't want anyone in pain. So I reported a couple people this morning. It's heartbreaking, and it's making me want to pursue my career more actively now. I'm in pain now, but I have to do this because I will not get a C- on my in this class, which I loved. I had rehearsed my thing, but I think this was more better. This one was much better to explain about patient-centered care and how here in this country, some people are treating it. And I visit other countries. I visit countries where in the labor room they're shouting at the patients because they're younger, saying, shut up, you shouldn't have got pregnant and stuff. This is happening in America. Like, we're in a third world country where they're getting paid decent money and they're not taking their job seriously. And it's no love. it's from some of them, not all of them. You have some. I'm on the 4th floor. They gave me a nice room. I wish you could see it, but that's my story. I have my nurse coming in now, so and that's my story.